How do you think that could be, changed? Because 3/4 of America is obese, and even we have the gyms and the fitness people, and you're in great shape. How do you? I mean, there's only, I don't know. What do you think could really get people to start really focusing? I mean, because there's so many things out there in front of them telling why they should be focusing, and they're just not doing it.
Right.
And you see these patients come in, and I guess it's just tough to try to get them to.
It's difficult. It has to come from within.
Yeah.
So with every patient, it's different. It's a different, stimulus to what's going to really make them change their ways. For some people, it's depression and anxiety, and so they overeat. And for other people, they're compensating for some other things, and it just depends. And obviously, time becomes an issue. And I think the way I encourage people here is I encourage small steps. I make them do one thing. Because one of the worst messages is to tell a woman, do this, do this, do this, and do this. And do it all by the next time I see you. It's not possible. One step at a time. So we'll make a simple step. What's one of the worst things you do during a day? You don't walk. You don't do any exercise. Start walking for 15 minutes every day. Make yourself. There's always time for a 15-minute walk.
What kind of scenarios do you have for men? Like recommendations for them, their annual...
Yeah.
Taking care of them,
Same thing for annual physicals. Men over the age of 40, prostate health becomes really important.
Right.
And definitely, heart disease is on the top of that. I do a lot of smoking cessation, so tobacco, it's one of the things that we're...
Major difference. If you start your diet and exercise really can make a huge difference to the point where you really don't really need a whole lot of medications, basically, because if you put in the right, that sort of thing.
Exactly.
Okay.
And it's about balance.
Okay.
I think... There's an imbalance, and that's why this country is heading towards obesity. I think we're eating larger and larger portions of unhealthier foods and then not exercising.
Okay.
If we tip that balance a little bit, it would make it easier. And that's what I'm saying. So sometimes diet habits are not so easy to break. So work on the other aspect. Work on getting them to burn some of those calories. Start with just a little walk. Then say, okay, write down everything you ate today and cut off 100 calories. Just pick something. So maybe it was a handful of potato chips. Maybe it was a soda, even if it was a diet soda. Take something and cut that out once a day. They start to feel different. They start to feel a lot better. And then, I'm a big believer in health maintenance and prevention. So start screenings early. So breast cancer screening, self-breast exams, mammograms, colonoscopies. I mean, that's where my focus is as far as keeping people healthy.
Technology. Have you seen anything that has piqued your interest technology-wise as far as, treating patients and things like that? What do you find is pretty cool that you like out there right now?
Yeah, everything. I mean, I think, number one, the internet has just, in a good way and in a bad way, educated.
With the WebMD, what's going on?
WebMD and just Google. Yeah. I mean, now it's like, if something goes wrong on your finger or you feel a certain symptom, you just Google it. I mean, that's the way to do it.
Do you think those are pretty accurate?
So, no, they're not that accurate. They're, the problem is that a lot of this information out there is very subjective.
I see.
So, and for good objective scientific data, I still think you need to, consult with your physician, just like the commercials say, speak to your doctor.
And
I think that's important. There was a reason why we did 4 years of medical school and several years of, residency training.
Are there any myths that you could think of about, when you're dealing with patients, or any myths out there about going to the doctor that you could think of that where you that you joke around with other doctors about, that sort of thing that you could talk about? Is there anything you could think of that...
as far as myths that patients come up with?
People think about doctors and things like that, or being scared to go to the doctor, that sort of thing.
Right. Well, I think more and more, I always tell people, find the doctor that's right for you. That's important. In the olden days, you went to the local doctor in the town, and that was your doctor. You had no choice. Now you have a choice, and you have to... This is a person who's your advocate for health. So pick the person who you really get along with. And if that relationship and that rapport is not there, then in the end it's your health that's going to suffer. I
see.
So I think, one thing I think that's a myth out there, if I had to pick something, would be something like, I think patients get really scared. Well, I don't want to go to my doctor. He or she's going to yell at me because I didn't lose the weight, or I didn't. We're your advocates. You don't have to be scared of us. We're not here to, we scare you a little bit so you do the right thing. But the whole point is, I mean, you're coming to us so we can help you take care of your health, and so
you are a very, very successful businesswoman, and besides, of course, with your practice and everything. Mm-hmm. So, how would you inspire someone? What would you tell them to do? Especially, we were mentioning about women.
Yeah.
What's a message that you would like to tell everyone out there that hey, I did it, you can do it.
Right. I think the number one message women need to hear now more than ever is you can do it all. Mm-hmm. You really can. Mm-hmm. You can be a good mother. You can be a good wife or girlfriend. You can be a good female. You can be a really good businesswoman. You can be a good physician. And you can do it all. It's not easy. It takes a lot of juggling. It takes a lot of prioritization. And, you have to, take a lot of steps to get there. Mm-hmm. But it can be done. And there's something very fulfilling about being happy and loving what you do as a career. And at the same time to be able to go home and be a good mother and a good wife and to be able to balance the two, and it can be done. And I think all along training, you always hear that, oh, you're gonna have kids during residency, oh, it's gonna be hard, oh, it's gonna be, you
just gotta go for it.
You gotta go for it. And there's no right time for everything, and there's no perfect time to have children, there's no perfect time to go back to school, there's no perfect time to open a practice.
A lot of people get caught up in the whole perfect time thing.
Yeah,
I'm at this age, I should have succeeded here, or right. I need to have had this, and it's prime example. It's like you have to just lay the foundation,
right?
And
then after that,
and
go get it, go get what you want, and go live, and you have to be passionate about something to be able to go after it, and I think a lot of people forget what they're passionate about. Mm-hmm. They love to write or they love to cook, and they do get caught up in a lot of details, like, or even medicine these days. We see the healthcare in such a bad state right now, and so much change is happening, and we don't know if that's all good change or where it's going to end up. I feel like there's so many young people out there that are very discouraged to go into medicine. It's a great profession. I mean, you're taking care of people's lives every single day. You're touching every one of their lives, and you learn so much from them. So much from your elderly patients, even your young patients, and it's that relationship, and that in medicine is always going to be there. And I think so many young people are staying away from medicine right now and going into other fields because there's no money in it. It's more than that,
people they get sidetracked with that whole money and caught up, and they don't realize what it's really supposed to be about.
Follow your passion, and I think that's a big message to the young people out there, and go get what you want. And it may not be easy, and there's going to be obstacles in your way, but if you let them get in your way,
that's right.
There's always the other side.
Well,
always.
Dr. Niti Peruvemba, I tell you what, this has been awesome. You are the Go Lifestyle,
Thank
and
you.
I know a lot of people are going to be inspired by this, so this is cool. Thank you very much.
Thank you so much.
All right, cool. Cheers.